From the last time we'd seen you, do you feel like you've had any changes at all in your symptoms?
Not really, but I've been faint, lightheaded several times.
Okay.
That,
Do you notice that since taking the Keppra?
yeah, I was wondering if it was the medicines.
Yeah, sometimes it can be. The only thing is sometimes it's better to take the medicine and kind of deal with the lightheadedness than it is to have another seizure. Any more nausea, vomiting, anything like that?
No.
Okay. Feel like the headaches are still about the same, or do you feel like those continue to get worse?
About the same. Now in the past they came on slow, and then when we were in the middle of it, it was, I'd go to bed, wake up the next day, or hours later, maybe get over it. But now it's happening really fast.
Okay.
It comes on real quick. The pain is excruciating within 15 minutes, and then maybe 20 minutes later, it's gone.
Open your eyes. Look this way. Good. Look straight here. Tell me you can see my fingers moving.
Got to.
Good.
Wait, stop. I gotta go. Yeah.
Good. Okay. Smile real big for me. Stick your tongue out. Say ah.
Ah.
Good. Good. Does that feel the same on both sides here?
Yeah.
Good. Shrug your shoulders up. Good. Close your eyes really tight. Really tight. Good. Okay. Now puff out your cheeks. Good. All right. Give me a squeeze. Tight as you can. Good. Take your finger. Touch your nose. Touch my finger. Same on that side. Touch your nose. Touch my finger. Turn your palms like this. Raise them up. Turn your palms more towards the sky if you can. A little bit more that way. There we go. Close your eyes and keep them up there. Don't let them fall. Good. You can put them back down. Check some reflexes on these.
I wondered what that thing was.
Yep. A little torture device.
We thought it was something, it looked like something else, but.
A probe.
No, you'd be in the wrong office for that.
We're like, that's an awful big probe.
Alright, straighten this leg out. Keep it straight. Keep it straight. Okay, same on this side. Keep it straight. Good. Relax this foot. Good. Any numbness or tingling at all through here? Nothing into the hands or the arms. Okay.
You're walking around doing okay?
Yeah.
Okay. The headaches are getting a little worse?
They're still there. The whole process goes real quick now. I used to have a migraine that would slowly come on, finally peak, and then go away, which was hours. Now the whole thing can be within an hour.
Okay. And your vision is still doing okay?
Yeah, there's occasionally when I get the lightheaded, fainty feeling or the headaches, I see like tracers, like
Okay.
if you looked at something bright and look away. That
The note I got from the eye doctor felt like you weren't having any side effects vision-wise from the tumor, at least. So that's good to know.
Yeah.
Okay. Okay. So at some point we should probably talk about taking this thing out. I wanted to go over that in good detail with you today. So right behind your eyes is where this tumor is growing. So we can see all of that right there. We know that it's pushing on the nerve to that provides your smell. You've had trouble with smelling for a few years, right?
Yeah.
And it's very close to the nerve to the eyes. Okay. This is most likely what we call a meningioma. Those tend to be pretty slow growing. They're what we call benign in most situations. They're not going to spread anyplace else. It's just sometimes they get pretty big and have an incision that starts in front of this ear and comes all the way around here to this ear right here. Okay, so it's a big incision from ear to ear essentially. And what we do is we kind of pull all this stuff down and it gets us right here.
Oh, jeez.
Yeah, it's a big surgery. What we do is we take out a piece of the forehead bone, so we pull that out of the way, and then we can open up that lining around the brain. And then what that allows us to do is we can slide right underneath the brain here, and that tumor is going to be sitting right in here. Okay, so we slide underneath the brain, we find that tumor, we start taking it out, we find those nerves to the eyes, and of course do our best to protect those and take the tumor out. The whole surgery is probably going to be 4 or 5 hours. So until after surgery, we close everything up and you're in the ICU. You'll probably be in the ICU for a day or two, and then in the hospital for a couple days after that. So anywhere from 3 to 5 days. So let's spend some time talking about the risk. Anytime we do surgery, there's a risk of infection. We give you antibiotics before and after to minimize that as much as possible. The risk of an infection for something like this is probably about 4 or 5%. If it happens, it can be a really big deal. Sometimes we have to go in there, wash everything out, re-close it. Sometimes we even have to take the bone out and put a prosthesis in at a later time. So infections are a really big deal if they happen, okay? The other big risk is sometimes whenever we take these tumors out, we can have some bleeding after surgery. And that's why you have to go to the ICU, so we can keep a close eye on you. Sometimes we have to go in and take blood out. The risk of that happening is also about 3-4%, okay? Anytime we do surgery on the brain, there's a risk of a stroke. That can look like having trouble moving one side, the other big risk to understand is the nerves to the eyes. Right now this tumor is not causing trouble with those nerves, but we can assume that those nerves are still being pressed on. So I would say that there's probably a 10% risk of having some problems with your vision after surgery. The risk of being completely blind is low, probably 2-3%. The risk of having some vision problems that my hope would get better is probably as high as 10%. Okay. Whenever we take these tumors out, sometimes they can leave kind of essentially almost like a hole in the base of your skull from where they were. And we have ways of repairing that. Sometimes we can have trouble having spinal fluid leaking. You know, people can have spinal fluid draining from their nose or down their throat after a surgery like this. And there's different things we can do to fix that. But the risk of that happening is probably about 5%. Sometimes we'll even put some drains in. Sometimes we'll put a drain in the back to help drain that spinal fluid, kind of decrease the pressure in the system overall. I know this is a lot of information. What questions do you have?
When?
Okay. So is this the kind of thing you want to do as soon as possible?
Yeah.
Is that what you're thinking? Okay. So I'm gonna speak to my partner. I'm gonna have help me with this. So we'll just need to kind of coordinate things. I'm hoping within the next 2 to 3 weeks we can.
Any over-the-counter pain medicine, we have you stop a week before surgery. You can take Tylenol, but that's it.
Tylenol,
Okay.
yeah.
Mhm.
Yeah.
So any headaches, take Tylenol.
Yeah.
Okay. Any over-the-counter aspirins, 10 days before surgery, we have you stop those. And then any vitamins, minerals, herbs, supplements, anything like that, we have you stop 2 weeks before surgery, 14 days. Okay. Close to the end of that packet, we'll show your after-surgery restrictions and activity restrictions, things like that. So
Okay.
make sure you pay attention to those. If you do have any questions, please do call us.